The next day, they said this heart actually come from outside of America. Take her out from the operation room to the her recovery room. And doctors, he came and he was really happy and he called me, Mom, come. You are crying for your daughter. Look how your daughter now. I said, Alhamdulillah. First I said, Subhanallah, because she moving, her hand, leg, everything she moved. Because and doctor told me to look how she's moving now. After 3 months, I saw her when she moved her body, leg, hand. Then we come back home, little by little, alhamdulillah, she's going, alhamdulillah, she's going normal, everything. She walks, she talks. Now she doesn't talk like is after 1 year or 2.5 years because they're using the ventilation 3 months. And her actually the voice nerve actually going, I don't know how I'm going to explain to you.
Vocal cord?
Yes, it's gone already, that's it. And maybe she can talk, maybe not. That's why I always say, Alhamdulillah, I read the Surah Fatiha. Long here, Alhamdulillah, she started talking like it's after 1 year, maybe only 1.5 years, Alhamdulillah. It's completed 2 years, Alhamdulillah. She never have any complaining. Completely good, Alhamdulillah. She's a normal child. If I say the people that she's a transplant patient, people are asking how she's transplant. She's good, looks, she's good. She's walking, she's running. Everything is good, Alhamdulillah. Her eye is back, Alhamdulillah. Her kidney is good. She doesn't need any operation. Only she needs, when she's 6 years old, she has surgery for her eye. Because doctors say if she can take the surgery, her eye completely going good, Alhamdulillah. After 6 years, when during his turning 6 years, she has operation. Alhamdulillah, after operation, her eyes is good, Alhamdulillah. And I don't have any problem with her until 6. When she passed away, this is her age is 16.5 years old. She never have no rejection. She doesn't have no problem. Alhamdulillah, she is going normal. Everything she doing work, everything, and she was everything asking how I think I forgot actually bring her note also. She write down all this. Today I forgot actually. Because when she thinks something, she write, come to me. And I told her when she got the doctors, the visit, she asked the doctor also and she write down everything. And today actually I forgot to bring the note for her diary. But she said, Mommy, I like to write the diary, and I will. She like to go to the. I think she said I like to go to the social media to show the people, and how is actually transplant. Don't be scared for the transplant. Any transplant. If you take the easier, is easier. Alhamdulillah. And Alhamdulillah, the only things before she passed away, before 1 month. Then she said, Mommy, when I go walk, I feel I'm tired. I said, Are you sure? She said, Yes, Mommy. This is my first time actually I figure out that I look tired because I don't know, I don't like to walk. Then right away I called the doctors and I told her, I think you have anemia, maybe. I think the problem for anemia, Mommy, sometimes it happens. And she said, Oh, okay, maybe. Then I called the doctors and my daughter, she's complaining, like when she walks, she feels tired. The doctor said, No, you can come back tomorrow. You can take her tomorrow, we can see what happened. I said, Why? They said, We don't know, but we have to check everything. So I said, Okay. And I taking them when they have to echocardiogram, and doctor told me because she has rejection. And he was asking Amira, how's it happen? And she explained to him. And she said, before echocardiogram, he said, maybe she has rejection. Then after echocardiogram, he showed me the video and like how she looks, her heart actually looks showing the swelling, like this means she has rejection. But how much actually they doesn't know, but they said they have to go to the biopsy. Biopsy shows she doesn't have no rejection. And they have to take another, by this time they're starting for her steroid, extra dose. And they said, after 1 week, they said, no, we have to take another biopsy her because it looks like she has rejection, but her biopsy says she doesn't have no rejection. That time they say we have to do another test. This is called MMDX test. I said, okay. Then MMDX result showing also she doesn't have no rejection. Her biopsy says no rejection, but her symptoms say she has rejection. And that time actually because she took already for extra dose steroid, her body she's really weak. She's really angry. She's she thinks because she's going to die. When she heard she has rejection, I look right away. She looking my face. I'm looking for her face also. And doctor said, "Don't worry. This is not a big rejection. This is a symptom like it's rejection, but not the bad rejection. Sometimes it's showing, but it's after you take the steroid, it's going gone. But she know, I don't know how she know already. She can go. She's not going to survive too long this dunya. Everything's like is every day, every 2 days, every 3 days, I take him to the emergency room. Because when doctor said, take her here, I take her right away. Taking like it's anytime, middle of the night, I take him. Anytime, daytime, right time, anytime I take him to the. But only thing, when I taking the, before she passed away, 1 week before, she has something on her body. Because her body actually showing she has a chicken pox. But this is not the chicken pox. Actually, when I call the doctor's office, they say you can bring her here, then we can check everything. Because she used steroid, that maybe when they're taking the first all test and she has any rejection. But the doctor told me this is not the chicken pox. This is mean because she takes steroid. Her body is really weak now. Her strength is really low. That's why everybody has this bacteria, but we are really strong. That's why it doesn't show your body, but she's good. But that time, actually, emergency doctor, he told me because she has a rejection. Then I told him, he said, you have to stay here. We have to start treatment for her, for the rejection treatment. I said, they already start her treatment because she already start for her steroid. Then why I have to stay here for the 3 days? Then he said she has a rejection. I said, his doctor say doesn't show clear. Her biopsy doesn't show clear. Her MMDX result doesn't show clear. Then how you figure out then she has rejection? And he said, mommy, is a rejection because symptom and showing because. When they start steroid actually make her cover the rejection. When we do the biopsy doesn't show because the medicine actually cover already. Then under cover you see the small red, then this is actually is rejection. But it's not the bad is rejection. It's just started. That's why we have to start treatment. I said, okay, can you give me the chance? I have to go home. I have to prepare and come back. Then we will start. Then I have to wait for her team because she has cardiologist team. They will call me to come back. The next day, actually, I call him again, her office, and they say, no, we are waiting for another test. When this result come back, then we will take her to the hospital and put in her IV. I said, okay. And that time I see she looks good. She looks good. She's walking. She's going everyday school. When she come back home, she can do her work, and she go outside also. And every Friday she can go to in EK Masjid for the YM group. She was good. But by this time she have to prepare to. She know that she can go to die. I don't know how she says she can go die. And one day actually she said, mommy, she worried about me because her father passed away. I'm alone myself. First day, actually, she took me to her dead room. Then, mommy, you put away all my clothes after I passed away. I said, what are you talking about? She said, mommy, I know my dad all clothes, he give you away for the, are you going to do these things? I said, Mommy, I don't like to hear anything. Can you stop? How you know then you can go passed away? She said, I know, Mommy. I said, Mommy, we don't know. I don't know. Maybe I can pass before you. Maybe your grandpa passed away before you. Who knows? But why you make, I thought she's scared, but she's not scared actually. She has to get ready to, anytime she can go past. Then after that she was asking, Mommy, what are you doing after I passed away? I say, again, you talking about this thing? She said, no, Mommy. No, you don't have nobody after I passed away. What are you going to do? At that time I really mad about her. I never think she realized, but I couldn't realize. And she said, Mommy, after I passed away, I have so many clothes, I have so many jackets, I have so many shoes, I have so many medicine. Please don't keep it. Can you give it who actually need it? Then I was really mad and I said, can you go? And actually, I don't, right now actually, that time I couldn't realize she can go. What she says is true. Then she called her uncle and she said, I like to talk to my mommy, and my mommy doesn't understand me. I like to explain to my mom before I passed away. Can you tell my mom after I passed away? I know she like to saving my old clothes for memory, but I like to give the charity people. After her passed away, I heard her so many friends. Her name is in YM group. She's talking to, and she's ready to anytime she can pass away. She told her friend, my mom doesn't have no one. My mom doesn't have anybody. Only that I'm one child for her. I don't know who's going to take care of my mom. After her dad passed away, and she worried about me. She said, Mommy, don't worry. I'm finished my 2 years. Only 2 years I'm going to finish my high school. Then I will do the part-time job. I will support you. But this friend actually always, she called me, talked to me, because what actually Amira said to her. Exactly Friday she passed away. Before 1 week Friday, they have YM group, they have halakha. After halakha, the girl was asking, like, we're wishing something from Allah, then I need something. Then she asking for all this girl, what you for wishing for yourself? She said, oh, somebody said something else. Somebody said, I like to going to be doctor, engineer, going to art, something. And she said, I want to see my dad. This is my wish. The next Friday she is going to pass away. This day actually, this is Friday morning, make her up, and she right away go to the bathroom, make wudu, and she start praying. And I thought, why are you taking too long? Can you go? Let's go, Mommy, we are going too late. Then they're going to school. I heard she's laughing. I laugh with her. I'm laughing too. And after she's done, I say, Mommy, why you laugh? I see she never respond to me. Then I turn my face to her. I see that time her leg actually straight, and her head actually fall like that. I said, what? Right away. I said, Ya Allah, what I can do? I thought she's senseless. Right away, I call the ambulance. They're not going to actually pick up my phone. This is the day actually weather is really bad. It's rainy and traffic all around. Then right away, I call my home. I call my sister-in-law. I call my brother-in-law. Nobody going to pick up my phone. Then I am actually out from the car. I scream to the people, can you help me? And nobody going to stop. One actually, I don't know, the people, they're Arabian. I think they're a Muslim family. The man actually right away take a U-turn and come to me. And he said, what happened, sister? I said, I need ambulance. And he called the ambulance too. I called ambulance too again. And now the ambulance came right away. Like it's 5 to 10 minutes. Then lady, she said, her heart doesn't respond. I said, she talked to me. I heard she's laughing. She said, Mommy, I know, but her heart doesn't respond. We are taking to the emergency. They will try to review her heart. And they're trying so many things, and they're asking so many questions. And the last one, the doctor said, if you sign out there for one medicine, we have to push her on nerve, directly going to the nerve. But if she live, she doesn't have no memory. She had, like, is her brainless. You can completely. If you agree with me, then I will do. I said, I don't mind. She had disabled for brain disabled, not anything, whatever she has. I want her. I don't know. This time I can. I don't know that this decision is good decision or bad decision. I don't know. I always say astaghfirullah. I keep say Allah. That time I know that she's my daughter. I don't like to lose her. I said, do it. But doctor again say, we have to this one. This medicine going to direct her nerve, but it's not good for her. I said, I don't care. Can you do it? That day. But she's gone, because I don't know, now actually after her passed away, I feel so guilty. Because she's already gone. They pushed so many medicine, so many things. And I keep saying, please don't stop. I want her life. And after then I call her, the transplant office. They will do something for her. I think she can going to survive this time also. The office, they have to return my call. And I said, can I talk to he said, can I talk to the emergency doctor? I said, yes. The emergency doctor, that time actually, the transplant office, he talked, and he gave the code number. And when they send some code already, they know that she passed. And he said, give phone to Mommy. Then he said, Mommy, I'm sorry. I said, what do you mean sorry? She said, she's gone already. And I said, no, she's not gone yet. That time I feel like I'm going to scream. Right away, my brain actually reminded to Allah. I stopped, right? I didn't scream. I cried, but I couldn't scream. But my heart said I'm going to scream to her. But just she's talking to me. She's laughing to me. In a few seconds, like she's